Welcome to another episode of Almost Ordained. I'm your host, David, the guy who graduated seminary but never got ordained. Okay, now I'm following up a little bit on last episode. I talked about how the shield was the most important piece of equipment to a Spartan warrior, because every other piece of equipment they used protected themselves. The shield protected the soldier next to you. That was a perfect analogy for why masks are so important in the fight against coronavirus, because it protects the people around you. Now, I've also raised a question of whether it protects you to wear a mask, or is it only about protecting others? And I honestly didn't know. According to Bill Nye, the science guy, it gives you some protection. How? When you speak, or cough, or sneeze, or laugh, or even just breathe, with every exhale, there's not just air. There's little droplets of water in that breath. You'll see it if you breathe on your glasses or a mirror. You know it will fog up. What is that fog? Little droplets of moisture. It happens every time you exhale. These little droplets fall to the ground eventually, but they're so small and light, they fall very slowly. They will hang around in the air for several minutes. Nye didn't give a specific time. They could be as short as 5 minutes or as long as 45 minutes. If you are infected with the coronavirus or any virus, those droplets will carry the virus with them. Therefore, the best way you can stop from breathing coronavirus into the air is to wear a mask. The mask will trap those droplets and keep them from getting into the air. But let's say you don't have it yet, but someone who does have it was in the room. You come along a couple of minutes later. Those droplets of the infected person are just still hanging around in the air, and you breathe them in. That is how some people are catching it. What's the best protection for that? Again, wear a mask. It will not only block your droplets from getting into the air, it will keep any coronavirus droplets that are already in the air from getting into you. Now, mask is only effective if you wear it correctly. I'll demonstrate the correct way to wear it. 1, grab the mask by the straps, not the mask itself. Then you put it on. Now this one has straps to go over the ears. And afterwards, sanitize your hands, just in case it has some droplets on it. Cover your mouth and nose. Do I have to put it over my nose too? Do you breathe through your nose? Then yes. Remember, every time you breathe, little droplets are in the air. You exhale from the mouth or from the nose. Don't pull it down when you talk. That defeats the whole purpose of the mask. The droplets are coming out when you talk. The purpose of the mask is to keep them from getting in, leaving here and getting into the air. You pull down the mask to talk, you're spreading it, your little droplets. That defeats the whole purpose. Avoid touching the mask. If you forget, wash or sanitize your hands. because by now it has some droplets in the fabric. Take it off by the straps, not by the mask itself. If it's washable, which this one isn't, drop it in the laundry. And wash or sanitize your hands again anytime you touch the mask. You know, the mask could be contaminated, so anytime you touch it, you want to wash or sanitize your hands. So with the mask on, I'm not only keeping my droplets from infecting you, I'm protecting myself from breathing in coronavirus droplets that someone else might have put in the air because they didn't wear a mask. So the analogy with the Spartan shield was accurate. If you remember, the shield does give you some protection in a shield wall, so it's protecting, you know, most of this side of my body. But it also extends to protect the soldier next to you. The mask also gives you some protection, but it is also mostly important because it protects the people around you. And since we're socially distanced, I'm not wearing it right now. Now, I understand there is some confusion about COVID-19, so I'm going to try to clear up some of that. Full disclosure, I'm not a doctor, epidemiologist, or any kind of expert in communicable diseases. That is true for the vast majority of us, so what I'm trying to do is get information from reliable sources and pass it on to you. Since I'm not an authority, I'll make the links available in the description so you can see where I got this from. One question, I guess, that's bound to come up. Why is it sometimes called COVID-19 and sometimes coronavirus? The simplest way to answer that is coronavirus is the virus we are concerned about, and COVID-19 is the disease caused by coronavirus. One analogy to it is HIV is a virus, and the disease it causes is AIDS. And why the 19? Was there a COVID 1 through 18 I somehow missed? No, there wasn't. The virus was first identified in the year 2019, hence COVID-19. That's it. Don't make this more complicated than it is. And no, you don't get it from drinking Corona beer. So, don't throw away those lime wedges. And some people are still saying, I don't know if masks help or not. First, ask yourself, why are you confused? Is it because you've heard conflicting reports on it from the experts? The truth is, most of our experts did make missteps in the beginning. At first, they did not give a clear message on this. The CDC and Dr. Fauci, for example, used to say masks would not help. Now they're saying wearing masks not only helps, it should be mandatory. What's up with that? You know, why did they change their minds? On April 3rd, the CDC made an announcement that everyone should wear masks. And the subheading of this article where I saw this was, "This announcement reverses the CDC's previous advice." Why are they changing their advice? Why are they reversing what they said before? Well, there were a number of reasons for that. First, this is a new virus. They had no experience with it, no data on it to guide any course of action. Second, Oh, a few weeks ago, Dr. Fauci admitted he discouraged the public from wearing masks because he discouraged it at first. At first, because he was worried that if everyone went out and bought up masks, there wouldn't be enough for the frontline medical workers and essential employees who had the most danger of exposure to the virus. That's understandable. You may remember all the stories in the news early on about how states, cities, and hospitals were scrambling to find PPE for their doctors and nurses, and sometimes came up short because before we fixed the problems in the supply chain. But still, you'd think he could have told us to make our own masks or wear a bandana. I mean, we now know pretty much anything is better than nothing. Third, and this goes back to not knowing much in the beginning. Before April 3rd, no one knew if people without symptoms could spread the virus. We now know they can. That is why the CDC changed. And this is why everyone should be wearing masks when they go out of the home. You can have it for several days before you show any symptoms. But all the while, you are spreading the virus through the droplets in your breath. You think you're fine. You feel fine. But like Typhoid Mary, you are spreading COVID-19 everywhere you go if you don't wear a mask. What kind of mask should we wear? We shouldn't get surgical masks or N95 masks because the healthcare workers need them. For the public, sewn double cloth masks are just as effective. So that's your best option. I wore one with an American flag in my last episode. But right now I don't want to use a good mask until I'm going out. So I just used that. And this one. I just used this one for demonstration purposes. If you don't find any you like to wear, there are videos on how to make them at home. So if you're confused because the experts did not stress or maybe even discouraged wearing masks back in January, February, and March, chalk that up to this is a new virus. Even the top experts did not have enough information to know for sure what to do. But because of the data they've been gathering every day since the first case appeared here, they know more now. That's why the recommendations changed. If you're confused because different people are saying different things, unfortunately, this is an inevitable result when conspiracy theorists get on social media and public health is turned into a political issue. You're going to have to sort good information from bad. Everyone has opinions, but not all opinions are equal. Are their opinions based on known facts about the disease and how it spreads? Or are they just opinions? Everyone has opinions. When I'm sick, I ask my doctor for his opinion because I know his medical opinions are based on facts, not some political or economic agenda. I don't ask for and I don't care about the opinions of friends, pundits, or politicians because their opinions won't be based on facts. Before you believe anyone, ask yourself these questions. 1, does this person or agency have expertise in this area? For example, medicine or epidemiology. 2, what is the most up-to-date information from those in number 1? Okay, information from, May, June, July is going to be more reliable than January, February, March. Get the most up-to-date information. That's most likely to be accurate. 3, if they don't have expertise, like I've already admitted I don't, where are they getting their information from? I'm doing my best to let you know where I'm getting my information from. I will make that available in the description. Too many people are spouting opinions with no basis in fact. Finally, don't assume that because your state opened up its businesses or you don't see people wearing masks, that it's safe. Over Memorial Day weekend, Myrtle Beach was opened up. One young woman from Minnesota came over with friends. She said she had been good about wearing a mask in Minnesota. But in Myrtle Beach, no one was wearing masks, so she figured she didn't need it there. She got sick, along with all of her friends who came along with her. States did not open up because it was safe. They opened up because we need to get people back to work. We need to get the economy moving again. Their reasons for opening up had nothing to do with your health and your safety. I'm certainly for getting the economy going again and for people being able to work again. But people's lives and health should be more important than money. My life, I certainly think my life is more important than your money, or even my money for that matter. I will spend my money to save my life. And I assume you feel the same way, although the way Americans have been acting, I'm not so sure. It's been like, this is going back a pretty long time, but television show, I don't remember what it was, maybe it was probably Jack Benny. They did this bit where he's walking along and this burglar comes out, pointed a gun at him and says, "Your money or your life?" Benny doesn't respond. Says again, "Your money or your life?" Doesn't say anything. "Well, I'm thinking. That's what it seems like a lot of Americans are doing. It should be obvious that your life is more important than your money, but people say, "Oh, I'm willing to die to get the economy going again. And I'm willing for you to die too." Yeah, people like that, I don't care about their opinions. This is my life, my health. Okay, so here's a case study that should tell us a lot. Despite its proximity to Italy, which was an epicenter in the early days of the pandemic, the Czech Republic has had hardly any cases of COVID-19. This is in spite of being unsuccessful in getting people to social distance, or no widespread stay-at-home orders, no long-lasting shutdowns of businesses, no contact tracing. They tried, but just couldn't get it going. And that's the case with a lot of these things. And having one of the lowest test rates in the world. Of all the standard recommendations, the only thing they could get the public fully on board with was wearing masks. So that is the one thing we can do, we can all do, to stop the spread of this disease. You want to know what happened in the Czech Republic? Let me pull up the article here. Okay, here we go. I gotta move it a little more. This is from an article in USA Today, dated July 14th. Czech leaders, including the Prime Minister, Interior Minister, Health Minister, set a proper example by wearing masks, appeared on television to urge the nation to make this collective sacrifice. Okay, so Notice, leadership at the top was all united. The political and the health leadership was all united in telling people to wear masks. They didn't leave it up to the states. That's part of the reason for, that's really part of the reasons for the confusion. If you're looking to the government to tell you, when it's safe and when it's not, or what we need to do to stay safe, you're not going to get consistent messaging. You don't get consistent messaging when you leave it up to the states. There's 50 states. And each governor is more worried about getting reelected than about keeping you safe. So, that was one way we could have. That was one thing, one missed opportunity. Okay, continuing. The government widely circulated a persuasive video articulating the philosophy of, quote, "My mask protects you, your mask protects me." You get that? Oh, Spartans certainly would have understood. The mask was like the shield. My shield protects the man next to me, and his shield protects me. Same with the mask. I wear my mask to protect you. You wear a mask to protect me. People responded positively. Masks quickly became the symbol of shared commitment to the battle against the pandemic. That is what is missing in this country. That is why we're in the mess we're in. That is why there are like 60, 70,000 new cases every day. We are not altogether committed. We are not shared in our commitment to battle against the pandemic. We're not committed to work together to stop the spread of the virus, to stop the spread of the illness. They were, and the mask was the symbol of that. And it was a perfect symbol. My mask protects you, your mask protects me. That says we're all in this together, and we're going to work together. That's the only way we will put an end to this. You want it to be over? We've all got to work together to make that happen. Masks worked in the Czech Republic. And they would work here if people would do it. Continuing. Through March, April, and most of May, only a small minority, perhaps 10 to 15%, could be seen without face coverings in the streets of Prague. Within 2 weeks of the government's mandatory mask order in mid-March, within 2 weeks, the daily number of new coronavirus cases dropped throughout the Czech Republic. In Prague, which had been the initial epicenter of the country's virus outbreak, that is their most populous city, by the way, daily new infections fell into double digits. Less than 100 new cases per day in April. Despite 2 localized outbreaks in an eastern province in recent weeks that raised the national numbers, the infection rate in Prague has remained statistically negligible, averaging only 16 new cases per day since the beginning of April. Now, I know their population is much less than ours, but still, 16 new cases per day. If you work it out on a per capita basis, that will still be much better than us. So, is there anything more we should read from that? Okay, I think, again, I will make the link to this available in the description. So, even in a country where people wouldn't follow all the recommendations consistently, they did wear masks, and it paid off. You look now, and life in the Czech Republic is mostly back to normal, without the spikes in cases and deaths we have here. That could have been us. We could have saved tens of thousands of people's lives and the economy if everyone had worn masks. By trying to save the economy, we saved neither. We can still change course. We can all wear masks whether the government requires it or not. That has been proven to be effective in the Czech Republic and other countries like Vietnam and Australia that have done it. The director of the NIH said, if we can get everyone wearing masks for 4 to 8 weeks, that would eliminate nearly all new cases of COVID-19. It's not a direct quote, but something to that effect. So, does that clear up the confusion? Folks, you have to realize COVID-19, coronavirus, is different from any illness that has happened in this country in the vast majority of our lifetimes, unless you are old enough to remember the Spanish flu. And there's a reason for that. I'll tell you, this is from, let's see, it's Dr. Gina Grayson said, in addition to being highly contagious, this novel coronavirus can cause a severe infection that can kill even healthy people. You think you have to be old and sick and immune compromised to die for it? No, it is killing young and healthy people too. It is rare to see both these bad attributes in the same novel virus. Usually it's one or the other. So in other words, usually a new virus is either highly contagious but not deadly, or highly deadly but not highly contagious. Coronavirus is a rare virus that is both highly contagious and deadly. That is why we can't treat it like the flu or, you know, a little historical comparison. There was 2002, 2003 SARS. You may have heard that. It was deadly, but it did not cause a pandemic because it didn't spread easily. Deadly, but not contagious. Swine flu in 2009. It was a new strain of H1N1 virus. Highly contagious, but not usually deadly. Coronavirus. Also, it is officially called SARS coronavirus 2, and the disease is called COVID-19. Remember, coronavirus is the virus, COVID-19 is the disease. This is both contagious and often deadly. There have been, let's see, in this country we have passed 15 million cases, maybe 16 million cases, and we've passed 150,000 deaths so far, and still counting. If you still won't wear a mask, I just have to ask, what is it going to take? We need to be together on this. We need a shared commitment from all of us to bring the numbers down, to stop, a shared commitment to stop the spread of the virus. It's not going to go away until that happens. So, again, I ask, what's it going to take? By now, we know what works. It's just a question of whether we're willing to do it. All right. Thanks for watching. I hope you'll come back for another episode of Almost Ordained. If this was helpful to you, or do you know it would be helpful to someone else, please share it, and go ahead and click the like button while you're here. And until we meet again, remember these words from Matthew 7, verse 12. In everything, do to others as you would have them do to you. For this is the law and the prophets. Grace and peace to you.